was called a crazy physician, but to me, he is the champion of breast cancer surgery. That is because more than half a century ago, he had a vision and was brave enough to propose a study that went against the prevailing treatment standard. He stood firm in the face of serious objections and opposition from the experts of his time. Fast forward to today, millions of women are indebted to his pioneering spirit. In this video, I will tell you his story, how his advocacy for women has paved a new treatment path, and how doctors today continue his legacy. This is the late Professor Umberto Veronesi. He was a renowned surgeon at the Milan Cancer Institute, subsequently renamed the European Institute of Oncology. He was the first surgeon in the world to propose a gentler operation for women with breast cancer. Let's find out the significant change that he created and how his legacy lives on and continues to benefit patients. Before Professor Veronesi came onto the breast cancer surgery scene, this was the common result of the only form of treatment for breast cancer, a mastectomy, the removal of the entire breast. The most well-known technique of mastectomy was one that was described by Dr. William Halsted. The operation was often referred to as the Halsted mastectomy. The journey to move surgical treatment away from the Halsted mastectomy was not an easy one. In this review, written posthumously in honor of his life work, Professor Veronesi was quoted as saying, "He was thought to be a crazy physician when he proposed a new conservative surgical approach instead of the traditional mutilating mastectomy." There was intense discussion at a meeting convened by the World Health Organization in 1969 when he presented a proposal for a randomized trial to compare the traditional mastectomy with a new conservative approach consisting of wide resection or quadrantectomy followed by radiotherapy. The proposal was unexpectedly accepted. This marked the beginning of a paradigm shift in the surgical treatment of breast cancer. Professor Veronesi alluded to this 1969 event in the article he wrote in the New England Journal of Medicine in 2002, reporting the 20-year follow-up for what became known as the Milan 1 trial. In that same article, he and his team reported that the long-term survival of women with early breast cancer who were treated with breast-conserving surgery and postoperative radiotherapy to the breast was virtually identical to the rate among women who underwent radical mastectomy. After a median follow-up of 20 years, the overall and breast cancer-specific survival rates were similar in the two groups. This data contributed to the formulation of guidelines on the use of this surgical treatment strategy. Due to Professor Veronesi's visionary and pioneering spirit, most women with early-stage breast cancer can now undergo breast conservation treatment and survive cancer without having to undergo the extensive and mutilating operation known as mastectomy. With breast conservation treatment, also referred to as lumpectomy, quadrantectomy, segmental mastectomy, or partial mastectomy, women can look forward to cosmetic results such as this patient had after treatment. Here is her surgical scar, and this is the demarcation of the zone of radiation therapy. In this patient's case, she was cured of cancer as she met her demise many years after cancer treatment from complications of kidney failure. She did not have any recurrent breast cancer for the rest of her life. The seminal report of the Milan 1 study, together with other trials, led to a paradigm shift in the surgical treatment of breast cancer, with breast conservation treatment being recommended as the preferred mode of therapy instead of mastectomy. Subsequently, there were more studies comparing these two treatment strategies. Retrospective registry-based studies have demonstrated that breast conservation treatment may confer superior survival outcomes or better cure rates. These improved cure rates have been supported by systematic reviews and meta-analyses. This is an excerpt from one such meta-analysis recently published, which demonstrates significant benefits of breast-conserving surgery on overall survival at both 5 and 10 years when compared with mastectomy. Please comment below if you wish to have a detailed discussion of this study. In this summary of the recent St. Gallen Breast Cancer Conference, where a panel of many international experts gathered to formulate a consensus about the treatment of early-stage breast cancer, these doctors state that with respect to breast surgery, the panel made it very clear that breast-conserving surgery is the surgical method of choice and unnecessary mastectomies must be avoided. So there has been a paradigm shift in the surgical treatment from the Halsted mastectomy, which was the standard of treatment before Professor Veronesi proposed the new trial, to today, where it is the explicit opinion of a panel of international experts that unnecessary mastectomies should be avoided. More than 5 decades of data have brought us both patients and physicians to this point where breast-conserving surgery is the surgical choice for the majority of women with breast cancer. I hope that women will bear this data in mind, discuss it with their doctor to see if they are eligible for breast conservation treatment, and make an evidence-based decision for their treatment. It is only through a conscientious adherence to this policy that we can improve survival outcomes for the population of patients with breast cancer as a whole. This is Professor Veronesi's legacy. The Veronesi quadrantectomy, which is the predecessor of what we term as breast-conserving surgery or lumpectomy today, represents a great milestone in the treatment of breast cancer. It is the first conservative protocol scientifically validated. His pioneering work enabled women to undergo minimum effective treatment rather than maximum tolerable surgery to achieve the best long-term survival and a high quality of life in survivorship. It is hoped that as many patients as possible will benefit from his great foresight and perseverance. In our other videos, we will explore further exciting work that was built on the foundation of Professor Veronesi's efforts. Do join us as we delve into more detail about breast conservation treatment. Please like, share, comment, and subscribe to be notified of more content. Until next time, take care.